Majina yangu naitwa Praxidis Yagola Ouma. Mimi ni mkaaji wa Malanga, Masievi area. Mimi nina watoto 4, niko na mume. Mtoto wa kwanza ako form 2, wa pili class 7, wa tatu 4, wa 4 2. Mzigo niliobeba ni 5. Last month nilikuja hapa, mtoto amekatwa. Nilikuwa ninatumwa na Mbale. Kwa sababu unaambiwa uzi imeisha ya kushona ama dawa hakuna. Sasa wanakuambia uende na Mbale. Unaona sasa ukiwa mtu wa chini kabisa kama mimi na kutoka hapa kwenda na Mbale ni fair. Na labda hauna. Utafanya nini? Hasa sisi kama wamama wajawazito. Unaweza patwa na uchungu wa kawaida mama kujifungua. Na hauna mkunga karibu. Na sasa ukikuja hapa, labda daktari hawana manyumba zao, wenye ukikuja maternity. Itakubidi uvumilie, uende na Mbale.
The supply of drugs is not adequate. Because sometimes we get drugs that are very essential, especially this area, being a malaria endemic area, we have so many patients having malaria. There is a shortage of drugs, especially the essential drugs, which are needed in a dispensary. They are not being supplied adequately.
The round 1 of devolution, most people had really not understand various roles. Every MCA wanted to have this milestone of just bringing up projects and buildings, and to them it was brick and mortar. That is what could show that actually they're working. But there was not enough consultation between the department and them. The project was there previously, maybe by CDF or is started by somebody else, but it's never finished. You end up starting another project. The people in that area are really not getting even the service they're supposed to be getting, because we have elephant projects there that are not finished and they cannot be used. Malanga, we had several unfinished projects there.
Jengo umekwama, ile inahitajika renovation, hakuna mtu ameshughulikia. Vile tumesema choo haziko. Ile ni maternity wing. Ilijengwa na CDF. Na wakati county ilikuja haiku consult. Sasa kuna vitu yote mbili haitusaidii na imekula pesa. Hii haifanyi kazi, hiyo haiendelei na pesa zimemwagika pale.
There is incinerator here and it's not complete. So when you look at what these facilities have, and those are great ideas, are just what we are trying to now see how to fit in with the resources from the county government.
We don't have enough capacity at the community level in terms of public participation to really critically analyze and interrogate budgets. And communities have abdicated their role and left it to politicians to play around with their budgets. No wonder sometimes we get very skewed implementation of projects, because this could come to the advantage of the politician instead of to the advantage of the general voter in that area. SEDIC has done us proud. They've called for us politicians, the decision makers, the policy makers, into meetings and allowing us to present real-time data, scorecards, and evidence. You just thank God for it, because you use that opportunity to actually demonstrate the performance of individual wards in terms of health service delivery. And the MCS were shocked. Some of them were performing extremely poorly.
Hatukuwa na ufahamu wa miradi ambazo zilikuwa zinaendelea kwa area yetu, wa ward yetu, na kwa county as a whole. Kwa hivyo hii ilifanya nijiunge na CDC, nifunzwe vile ya kuwa budget champion, kufuatilia budget process ya county and national.
So we have trained budget facilitators and they have trained budget champions. For me, success in fact will be if they engage that third tier. If budget champions now in their communities are engaging with those community members, we will have made a big move in capacity building.
People were able to apply what they were learning almost immediately. But number two, I think there is value when people realize that certain things that often look complex were now within their reach in terms of engagement and understanding. And so the budget champions model quickly picked up, and in all the 4 rounds of capacity building that we've done, now the budget champions model has become a central piece of that work.
Sasa hapa tungeomba kama serikali ingetusikia, wajengee madaktari nyumba na labu pia ziishe. Hata unapoanza kugonjeka usiku, ukikuja hapa utahudumiwa kiurahisi. Hautasema niende Nambale na labda hauna pesa, ama uende Busia na hauna pesa. Itakuwa ngumu.
Dispensary right now from the guidelines, we must have a maternity where our women don't have to walk a long distance to go and deliver far away, because most mothers will tell you labor comes at night. So tell me somebody from Malanga all the way to Nambale or all the way to BCRH, they will deliver on the way, so they will rather go to a TBA near their home.
The ideal situation for any health facility worth its name in this county is that we should have a facility that should offer all the primary health care services, including deliveries, including laboratory services, the very essential laboratory. As we prepare communities to come forward and claim their rights in health, they should also meet an equally prepared system to receive them and to give them comprehensive services, so that again, we are in business, the customer and the service provider.
One thing I want to appreciate, especially this organization of CDEC, they have really helped this facility. When they started working with the facility, we didn't have toilet for the patients. There was even a letter that was written that we were given 2 weeks. If there are no toilets, we close up the facility. They mobilized the community, they formed a committee, they went up to the chief officer, they talked to him, and he released some money, which was brought on the ground, and the toilets were built. When I reported here, there were so many stalled buildings, and through the working hand in hand with CDEC, we were able to meet the Chief Officer of Health and also the County Assembly, and they allocated some funds for this facility. So we are praying that those funds that have been allocated, they'll do some marvelous job on the ground.
But through their lobbying, those budget cafes, those meetings at the community level, we have seen the MCA come on board. Through the efforts of CDEC, we have seen that that community in Malanga is going to benefit, because the maternity is under the 8 million that has been allocated. We're sure it's going to finish that maternity.
Kwa saa hii mimi ni mjamzito. Mara mingi tunapokuja hapa daktari wanasema tujisifungulie nyumbani, tukuje hospitali. Na hospitali niko nayo karibu ni hapa Malanga. Ningependa nikikuja hapa usiku, hata nikipatwa na uchungu na nikuja hapa usiku, daktari akuwe anihudumie. Akishanihudumia, hata nikiwa na shida ingine ikitokezea nitibiwe, nikienda nyumbani niwe salama. Hata mtoto akikuja akiwa hali mbaya, kwa sababu ukikuja hapa haukuangi na pesa ingine ya kuenda Nambale ama ya kuenda Busia. Wao wanatuhudumia vizuri, tunapata madawa ya kutosha, tunatibu watoto wetu, ama sisi wenyewe pia tunajitibu, tunaenda nyumbani. Hapo tutafurahia.